Introduction. Blood pressure, hypertension, treatment. Blood pressure is a measure of the force exerted by the blood against the walls of the blood vessels. Hypertension, also known as high blood pressure, is a condition in which the blood pressure is consistently elevated above the normal range. Hypertension is a common medical condition that affects millions of people worldwide and is a major risk factor for cardiovascular diseases, such as heart attack, stroke, and kidney disease. In this essay, we will discuss the classification, diagnosis, pathophysiology, complications, risk factors, and treatment options for hypertension. Classification of hypertension. Hypertension is classified into two main categories based on the underlying cause. Primary hypertension. Primary hypertension, also known as essential hypertension, is the most common form of hypertension and has no identifiable cause. It develops over time and is usually associated with lifestyle factors, such as diet, physical activity, and stress. Secondary hypertension. Secondary hypertension is less common and is caused by an underlying medical condition, such as kidney disease, endocrine disorders, or certain medications. Hypertension can also be classified based on the severity of the condition. Stage 1 hypertension. Stage 1 hypertension is defined as a systolic blood pressure, SBP, of 130 to 139 mm of mercury or a diastolic blood pressure, DBP, of 80 to 89 mm of mercury. Stage 2 hypertension. Stage 2 hypertension is defined as a SBP of 140 mm of mercury or higher or a DBP of 90 mm of mercury or higher. Hypertensive crisis. A hypertensive crisis is a severe elevation in blood pressure, with a SBP of 180 mm of mercury or higher or a DBP of 120 mm of mercury or higher. Hypertensive crisis is a medical emergency and requires immediate treatment to prevent complications. Diagnosis of hypertension. Hypertension is typically diagnosed by measuring the blood pressure using a sphygmomanometer, which consists of an inflatable cuff and a pressure gauge. The blood pressure is measured in millimeters of mercury, mmHg, and is expressed as two numbers, the SBP and DBP. Blood pressure should be measured in both arms, and the average of two or more readings should be used to diagnose hypertension. The following are the diagnostic criteria for hypertension. Normal blood pressure, SBP less than 120 mm of mercury and DBP less than 80 mm of mercury. Elevated blood pressure, SBP 120 to 129 mm of mercury and DBP less than 80 mm of mercury. Stage 1 hypertension, SBP 130 to 139 mm of mercury or DBP 80 to 89 mm of mercury. Stage 2 hypertension, SBP 140 mm of mercury or higher or DBP 90 mm of mercury or higher. Hypertensive crisis, SBP 180 mm of mercury or higher or DBP 120 mm of mercury or higher. Pathophysiology of hypertension. The exact pathophysiology of hypertension is not fully understood, but it is believed to involve a combination of genetic, environmental, and lifestyle factors. The following are some of the key mechanisms involved in the development of hypertension. Increased peripheral resistance. Hypertension is often associated with increased peripheral resistance, which is caused by narrowing of the blood vessels due to the accumulation of plaque or thickening of the arterial walls. This results in increased resistance to blood flow and higher blood pressure. 1. Increased cardiac output. In some cases, hypertension is associated with increased cardiac output, which is the amount of blood pumped by the heart per minute. This can be caused by an increase in heart rate or stroke volume, which can lead to higher blood pressure. Renin-angiotensin-aldosterone system, RAS, activation. The RAS is a complex hormonal system that regulates blood pressure and fluid balance in the body. In hypertension, there is often an overactivation of the RAS, which leads to increased retention of sodium and water and vasoconstriction, resulting in higher blood pressure. Sympathetic nervous system activation. The sympathetic nervous system plays a key role in regulating blood pressure by controlling the constriction and relaxation of blood vessels. In hypertension, there is often an overactivation of the sympathetic nervous system, which leads to increased vasoconstriction and higher blood pressure. Complications of hypertension. 1. Hypertension is a major risk factor for cardiovascular diseases, such as heart attack, stroke, and heart failure. It can also lead to other complications, such as kidney disease, vision loss, and cognitive impairment. The following are some of the most common complications of hypertension. Cardiovascular diseases. Hypertension increases the risk of developing cardiovascular diseases, such as coronary artery disease, heart attack, and stroke, by damaging the blood vessels and increasing the workload on the heart. Kidney disease. Hypertension can damage the kidneys by reducing blood flow to the kidneys, causing scarring and damage to the renal tissues. Vision loss. Hypertension can damage the blood vessels in the eyes, leading to vision loss or blindness. 5. Cognitive impairment. Hypertension has been linked to cognitive impairment and dementia, possibly due to reduced blood flow to the brain. Risk factors for hypertension. Hypertension is a complex condition that is influenced by multiple genetic, environmental, and lifestyle factors. The following are some of the most common risk factors for hypertension. Age. Hypertension is more common in older adults, as the blood vessels become less flexible with age. Family history. Hypertension often runs in families, suggesting a genetic component. Obesity. Excess body weight is a major risk factor for hypertension, as it increases the workload on the heart and blood vessels. Physical inactivity. Lack of physical activity is a major risk factor for hypertension, as it can lead to weight gain and reduce the flexibility of blood vessels. Smoking. Smoking damages the blood vessels and increases the risk of developing hypertension. Alcohol consumption. Excessive alcohol consumption can increase blood pressure and damage the blood vessels. Stress. Chronic stress can increase blood pressure by activating the sympathetic nervous system and the RAS. Treatment options for hypertension. The goals of hypertension treatment are to reduce blood pressure to the normal range and prevent complications. The following are some of the most common treatment options for hypertension. Lifestyle modifications. Lifestyle modifications, such as regular exercise, weight loss, and a healthy diet, can help lower blood pressure and reduce the risk of complications. Medications. There are several classes of medications that can be used to treat hypertension, including diuretics, ACE inhibitors, calcium channel blockers, and beta blockers. Diuretics. Diuretics are a class of medication that promotes the elimination of excess salt and water from the body, leading to a reduction in blood volume and blood pressure. They are often used as a first-line treatment for hypertension due to their low cost and effectiveness. Diuretics have been shown to reduce the risk of stroke, heart failure, and overall mortality in patients with hypertension. However, diuretics can cause electrolyte imbalances, such as low levels of potassium, which can lead to muscle weakness, cramps, and heart arrhythmias. They can also cause dehydration, especially in elderly patients, and may lead to an increased risk of falls. Additionally, diuretics can cause an increase in blood sugar levels, making them potentially unsuitable for patients with diabetes. ACE inhibitors. ACE inhibitors are a class of medication that block the activity of angiotensin-converting enzyme, ACE, which is responsible for converting angiotensin I to angiotensin II. Angiotensin II is a potent vasoconstrictor, and its blockade leads to dilation of blood vessels and a reduction in blood pressure. ACE inhibitors have been shown to reduce the risk of heart attack, stroke, and kidney disease in patients with hypertension. However, ACE inhibitors can cause a persistent cough, which can be a bothersome side effect for some patients. They can also cause hyperkalemia, high levels of potassium in the blood, especially in patients with kidney disease, and may cause a decrease in kidney function in some patients. Additionally, ACE inhibitors are contraindicated in pregnancy due to the risk of fetal harm. Calcium channel blockers. Calcium channel blockers are a class of medication that block the influx of calcium into vascular smooth muscle cells, leading to relaxation of the blood vessels and a reduction in blood pressure. Calcium channel blockers have been shown to reduce the risk of stroke, heart attack, and kidney disease in patients with hypertension. However, calcium channel blockers can cause side effects such as dizziness, headaches, and ankle swelling. They can also cause constipation and gastrointestinal disturbances, as well as flushing and palpitations in some patients. Additionally, calcium channel blockers may interact with other medications, such as beta blockers and digoxin, which can lead to adverse effects. Beta blockers. Beta blockers are a class of medication that block the activity of beta-adrenergic receptors, leading to a reduction in heart rate and cardiac output, and a reduction in blood pressure. Beta blockers have been shown to reduce the risk of heart attack and heart failure in patients with hypertension. However, beta blockers can cause side effects such as fatigue, dizziness, and cold extremities. They can also cause bronchospasm in patients with asthma or chronic obstructive pulmonary disease, COPD, and may mask the symptoms of hypoglycemia in patients with diabetes. Additionally, beta blockers may cause sexual dysfunction in some patients. Overall, the choice of medication for the treatment of hypertension depends on the individual patient's needs and medical history. It is important to work closely with the healthcare provider to determine the most appropriate treatment plan and to monitor for side effects and potential drug interactions. In some cases, a combination of medications may be necessary to achieve optimal blood pressure control. Monitoring and follow-up. Regular monitoring and follow-up with the healthcare provider is important to ensure that blood pressure is well controlled and to adjust treatment as needed. Conclusion. Hypertension is a common medical condition that affects millions of people worldwide and is a major risk factor for cardiovascular diseases, kidney disease, vision loss, and cognitive impairment. It is classified into primary and secondary hypertension and can be categorized based on the severity of the condition. Hypertension is diagnosed by measuring blood pressure using a sphygmomanometer, and treatment options include lifestyle modifications and medications. Regular monitoring and follow-up with a healthcare provider are important to ensure that blood pressure is well controlled and to prevent complications.